This episode offers psychosocial education designed to inspire and motivate our listeners. The information provided does not constitute a therapeutic relationship nor a substitute for professional mental health care. If you are experiencing a mental health crisis, call 911, go to your nearest emergency room, or for listeners in the United States, text 988 for the National Suicide and Crisis Lifeline. Warning, this episode contains brain food that will lead to improved emotional and social intelligence. Thanks for tuning in to Harvesting Happiness today for a healthy serving of consciously prepared brain food. This is Lisa Cypers Kamen, your host. Since 2010, we've been broadcasting sound ideas for better well-being. Each week, we spotlight diverse thinkers and doers who are contemporary trendsetters and change agents, devoting their lives to creating a better world. I invite you to listen and change how you think about human happiness. Our award-winning content is fresh, optimistic, and purpose-driven media that promotes well-being from the inside out. Good morning, good afternoon, and good evening, wherever you are. Thanks for joining me on today's show, where we are exploring from trauma to healing, how medical science is resetting the biology of PTSD. My guest today is Dr. Eugene Lipov. He is a board-certified anesthesiologist and pain specialist. He is also a champion for reframing PTSD, or post-traumatic stress disorder, as PTSI, post-traumatic stress injury. Dr. Lipov believes trauma is a biological condition, measurable, treatable, and reversible. He serves as Chief Medical Officer at Stella Center and is the author of the newly released book, The God Shot: Healing Trauma's Legacy, the Science, the Stories, the Solution. He's also driven by his own family's experience with untreated trauma. His mission is simple: to bring lasting relief to those who need it most. Welcome, Dr. Lipov. Thanks for joining me today.
Thanks for having me.
It is a pleasure. And you and I have a lot of areas of interest that cross over. Let's talk a little bit about part of your mission, which is to reframe or rename post-traumatic stress disorder.
All right. So here's the story. So the reason I got into that at all is because once I start doing stellar ganglion block, which we'll talk about it later, in order to understand why it works, you need to understand that so PTSD is a biological change in the brain, post-traumatic stress disorder. So, and language matters. So disorder is what's wrong with you. Injury is what happened to you, right? So if you think of it from that perspective, it makes sense. And the first person who coined the term PTSI, post-traumatic stress injury, was Frank Egbert, a very famous psychiatrist. He came up with the term Stockholm Syndrome. So in 2013, he and Pete Shirelli, a four-star journal, went to the American Psychiatric Association, and they said, please change the name because the soldiers are killing themselves. They hate the stigma. Yeah. So Frank and I connected. And now he's 87, so he's kind of done with this battle. So he handed off to me. And then I did a study in 2023. I asked 3,000 people, what would happen if you change the name PTSD to PTSI? And the majority said that we would have three things. Number one, we would have more hope. Number two, we'll get seen more. Number three, the stigma will get better. So I took their information, sent it to the APA, and they said, no, we're not going to do it. Not enough information. So I'm in a mission now to get 100,000 signatures. So if you can help me get more, it's not just signatures, it's a formal survey of IRB and all of that. So the name of the website, it's itsptsi.com. So if you go there, the survey takes about 2-3 minutes to do. That's all we need. So what I'm trying to do is get 100,000 signatures and go back to the American Psychiatric Association and say, look what I've been doing. Please help us change the name.
I think you're onto something because the stigma is huge. And in my own professional experience, post-traumatic stress is a exposure to abnormal amounts of stress, whether it's one incident or an accumulation of multiple incidents.
Yeah, 100%.
There's
no debate of that. Yeah. There's no question.
It's normal.
But the other thing is, people still, you'd think that'd be an argument, but There's no argument, because if you, Dr. Librazan, for example, in 1984, a few years ago, did a functional MRI looking at the brain of PTSD versus non-PTSD patient, and he found that amygdala was hyperactive in somebody with PTSD versus non-PTSD.
Mm-hmm.
If you take CSF or the fluid around the brain in a human, norepinephrine level is twice as high in a PTSD patient versus not. So there is a biologic difference. So saying that is this amorphous disorder, we're not doing anybody any good things, and people feel like freaks and they kill themselves. That's not good.
No.
Stigma kills. So I think people forget stigma will kill you. The vocabulary we use changes how people behave. That's a big deal.
And let's go towards the solution, because I think this is what is so exciting to me and what you've written about in the God Shot. So let's talk a little bit about the stellate ganglion block, because it's been around for a while. It's had different uses. So but I want you need to tell it in your own words, because it's exciting.
Well, I appreciate it. Well, first time the stellate ganglion block was ever done was 1925. My father was born in 1925. It was done for pain. So as a pain physician, the first time I did stellate ganglion block was 1987. And we did it blind at that time, meaning we just palpated and stuck a needle and hoped for the best. So now it's done with ultrasound, so it's more guided. But the first time it was done for PTSD, it was by me in 2006. And the first time I published on this, 2008. Then it got to Walter Reed, and Walter Reed started to replicate it. And then it got replicated in a number of other institutions. There was a big study that came out 2020 talking about in JAMA psychiatry. And there's a very big study being done right now using functional MRI before and after, showing that there's a brain change. Hopefully it'll show that in great clarity. That should be out in about 6 months.
Wow, this is amazing. Talk a little bit about the location of the stellate ganglion, because it's not on top of the head, it's in the neck.
Correct. So that was the first time I was in doctor's show. That was a question that all the doctors ask. It's like, how do you affect the brain by sticking something in the neck? It's like, that makes no sense. So in order to understand that, you need to understand the anatomy. So fight and flight systems lives in nucleus ceruleus, somewhere around pons, I can quite show it on me. Anyway.
Describe it to us.
So basically you have the brain. Right below is medulla oblongata, which is like another part that before the spinal cord starts. That's where nucleus ceruleus lives. So nucleus ceruleus, nerves come out of there, go into the neck, and up back to the brain. So there's a circle, right? So this is a nexus. So stellate ganglion is a nexus between nucleus ceruleus, which is beginning of sympathetic nerves, or fight and flight nerves, and the brain. So let me tell you what happens during trauma, and it'll all become clear. So when trauma happens, bang. The first thing that happens, norepinephrine is secreted. So if you're about to get hit by a bus, norepinephrine is secreted. And then you hyperventilate, you look around so you don't get hit by another bus. You can't sleep that night probably, and then it goes away because the trauma was not severe enough. But if the trauma is severe enough, being sexual trauma, being military, whatever, it activates something called NGF, nerve growth factor, in the brain. So then it goes from the brain down to the stellate ganglion, back to the same nexus, and it makes the nerves, fight and flight nerves, sympathetic nerves in the brain, sprout new nerves. That's called sprouting. Go figure. So instead of 4 nerves, let's say, now there are 8. And each one of those produces norepinephrine. As long as that persists, that could be 50, 100 years, people have symptoms of PTSD or PTSI. So turns out when you do local anesthetic, when you numb up the nerve, just like going to a dentist, except it's in the neck, what you're doing is 2 things happen. Number one, when you numb it up, 5 to 10 minutes later, norepinephrine levels drop very fast.
Wow.
And people feel better. They can take a deep breath. They smile. Sometimes they feel emotion. They can process their emotions, stuff like that. So it's quick. In about 1 or 2 weeks, NGF, nerve growth factor, goes down. So now instead of 8, it's back to 4, to the baseline. That's called pruning. That's been described in rat models. And so the longest outlier right now for one injection is 17 years.
Wow.
Right? So because what you're doing is reversing the sympathetic nervous system to the baseline. So when I talk about a reset, that's what we talk about. It's reset to the baseline.
Incredible. Incredible. Tell us a couple of stories about patients, please.
Sure. So the first one, we treated a guy who was special forces, and he was patrolling the street, and a 10-year-old kid was sent to take out his squad with an explosive belt on him. So Jason shoots this kid. Pieces of the child hit Jason, and the guy had severe PTSD. Comes home, tried to kill his wife a few times. So his employer father was my patient. So he called me up and said, "Can you help this guy?" I said, "Sure." So we do the block. So keep in mind, this was a severe case of PTSD. So
I can imagine.
Block, right? So 10 minutes later, he said, "I was going 120 miles per hour. Now I'm going at 20 miles per hour. I'm chill." I remember this intense, horrible scene. Now I remember in black and white, color is gone. So I feel much more calm.
Which it makes sense. It's logical.
Right. Exactly. And then the other one, which I like, was this guy. He was a sergeant in Vietnam. So he came to see me 50 years after the trauma. Right. So he had multiple admissions to psychiatric institutions, detox, you name it. So we do the block on him. He starts crying and he keeps crying for like half an hour. I was like, I broke this guy. What happened? So I went and I asked him, I said, "You're unhappy?" He says, "No, I'm really happy. I have not felt an emotion in 50 years. Now I feel an emotion." 3 years later, we were at the fundraiser for our non-for-profit, Erase PTSD Now. And his kids came by and they said, "You gave us our father back." I almost started crying, actually. So that was a beautiful story that he told. It's available on YouTube, but it's pretty crazy that you think, I mean, in medicine, most of the time, if you had a condition, the longer you have a condition, the harder it is to treat, typically. I mean, look at heart disease, fractures, whatever. That doesn't seem to be true for this. So in fact, the sicker the people are, the better response seems to be.
That's interesting. Yeah. What do you attribute that they just have been sort of at that high vibrational stress level for so long that the contrast of reducing it so quickly yields the good result?
It's something like that. I think in order to maintain this extremely high level of sympathetic tone, the body has to work very hard. So if you give it just a little reduction, it goes, "Oh, I can now rest. Oh my God, thank God. Thanks for turning the key off. My car is no longer running." But I think in order to maintain this very high norepinephrine level, it takes a lot of work. So if you drop it, it's such an abrupt drop and doesn't want to come back. It just takes too much energy to maintain that high state.
And I would think that the response on other systems of the body as well, that it reduces health risks in every other part of the body.
Yeah, so stellate ganglion block has a lot of interesting effect. Not only does it affect norepinephrine levels, so it turns out stellate ganglion is also connected to the thymus, which produces T cells, and bone marrow, which is B cells. So it's been demonstrated a number of times now. When you do stellate, it reduces interleukin-6 or immune dysregulation. When the immune system is whacked, it's not working well, it creates other problems.
Yeah.
It creates inflammation, right? Inflammation causes heart attacks, strokes, all of those things. In fact, people who have PTSD has twice the rate of heart attacks. It also affects infertility. So stellate seems to reverse infertility. I have to tell you a cute story about that, if that's okay.
Wow, please do. And then we'll take a break. Let's hear it.
Sure. So I took care of this young man who was a firefighter. So I took care of him and his wife. So people can get something called secondary PTSD from the primary PTSD. So they both came in, they both got treated, they did great. So I got a phone call 2 years later, and he said, "Doc, I feel great, blah, blah, blah. We had a child." I said, "That's great." He said, "You don't understand. We've tried for 20 years to get pregnant. Couldn't do it. We conceived the day after the block.
Wow.
So
Well,
I can tell you
the lowering of the stress level, it immediately contributes.
Well, that and increased circulation in the pelvis, all of that stuff. But guess what they called the child? Not Eugene, thankfully. Not Stella. Jordan, for Michael Jordan.
Oh, that's...
She's the cutest little thing. She's a blood girl. She's very feisty. She's very cute.
Wow. These are great stories and offer us great hope for post-traumatic stress. To learn more about the work of Dr. Eugene Lipov, please go to dreugenelipov.com. You can find him out there on social media at Dr. Eugene Lipov on Instagram and Facebook, and he's also on LinkedIn at Eugene Lipov, MD. We're talking about his book, The God Shot, Healing Trauma's Legacy, the Science, the Stories, the Solution. Here comes that pause. We'll be right back. Harvesting happiness is rooted in science. Our work facilitates applied positive psychology practices through media and consulting. We're committed to sound ideas for better well-being, leading to increased life satisfaction and a better world for everyone. We're not into pseudoscience or quick fixes. We're focused on common sense backed by rigorous research. Healthy critical thinking is the foundation for our discussions. We encourage you to challenge preconceptions and explore ideas with a curiously discerning mind. Collaboration with our guests is united by an inclusive vision to boost resilience, critical thinking, communication, and problem solving through civilized discourse and pleasurable relational engagement for everyone. Each day, we have the intellectual freedom to be happy or the liberty to be miserable, regardless of external circumstances. If you or someone you know is struggling with mental health, please seek support because good psychological health is vital to the achievement of a healthy and satisfying life. Visit harvestinghappiness.com for psychosocial and educational services that boost emotional and social intelligence. And we're back, continuing the conversation with my guest today, Dr. Eugene Lipov. He is the author of The God Shot, Healing Trauma's Legacy, the Science, the Stories, the Solution. Let's get back to the conversation. Dr. Lipov, let's talk about your personal connection to PTS or PTSI, because I know this is probably the biggest influence on your life.
Absolutely. So basically, my story was that my father was a flyer in World War II. So in a squadron of 10,000 people, 100 made it home. So he was one of those.
Wow.
And thank God he made it home, of course. But he had pretty severe PTSD, not that I knew the term at the time. And he gave it to my mother, who eventually took her life. So if it wasn't for that, I would have been a surgeon. I was a surgical resident at the time. So I switched from surgery to anesthesia, which I was not really a huge fan, frankly, of doing that. Anyway, I did that. And then through an interesting set of circumstances, I figured out that it works for PTSD. And then I've stuck with it big time, even though I've had some really interesting people push back on me, just because of my mother's history. Because, it's like she saw her psychiatrist the day before she took her life. So psychiatric pharmaceutical interventions I'm not a huge fan of. The efficacy of pharmaceuticals, the gold standard, they call it in VA, is about 40%. That's per Dr. Hogue, who happens to be a psychiatrist from Walter Reed. So, there's a lot of issues with current therapeutics. So, and then I understand fight and flight nervous system quite well, being a pain physician. But, I've been extremely fortunate to be able to work in the space and actually find other applications for stellate. But that's basically the reason. If every time I help a patient, I feel like my mother is giving me a pat in the back. So yeah. I live a beautiful life. I have no complaints.
This is an incredible story. And I appreciate what you are saying about psychopharmacology, because there's so much that we know sometimes things work, but there's so much we don't know about why they don't. It's hit or miss.
They don't work because we're in the wrong path. So let me give you an example of a real world example. And again, I have a jaundiced view, of course, for multiple reasons. So there are two people. So after I treated my first guy and I published 2008, Dr. Mulvaney did two guys in Walter Reed. Both were SEALs. They were both involved in very heavy combat. So one of them, after stellate, got into severe car accident. So I was talking to Dr. Mulvaney, and he said, what happens is, he was no longer raved. So the medication made him really sedate, and he got into a car accident. So the point is, if you think about it, I have a picture somewhere of people holding down the gas pedal and the brake together, right? So gas pedal is fight and flight. The brake is a medication. So if you take the foot off the gas pedal, brake becomes dominant and people fall asleep driving. So my suggestion is after stellate, half the drug. Do not stop them. Please do not. No, do not stop. You may have withdrawals, whatever. The point is, if you can reduce the sympathetic tone, you may not need most of the medication you're taking. But again, it has to be done under the care of a physician. Do not stop it suddenly. Again, please do not stop medication. But it just explains to you what you're asking. It's like, why doesn't this work? Because most people think about like psychiatric medication, a lot of them, it's increased serotonin, changes dopamine, whatever. I think a more basic system is sympathetic nervous system. It's much more basic. It's much original because if sympathetic system is revved up, other receptors don't make any difference because you're just too revved up to deal with it.
Well, and would you say that so many of the situations that we might experience, mental health crises, are a byproduct of traumatic events, right? That things happen to us in our lives, to all of us, and how we relate to those events also indicates how we might come out of them. In other words, if we treat ourselves like we're really sick and we have no hope, part of that becomes the reality.
Yeah, of course. But let me give you a real life example and you tell me what you think.
Okay.
So we took care of a young lady who was abused early in her life. Won't get in details. You don't need that in your head.
We can use our imaginations.
Yeah. Imagine something bad. She came in with 3 diagnoses. Diagnosis I, whatever, whichever way, plural is. So 1, PTSD. 2, multi-personality disorder. She had 13 personalities. Her dominant personality was a monster. 3, psychosis. So there's no medication for multi-personality disorder that I'm aware of. PTSD has its own set of medications, right? Psychosis has its own set of medications, right? So it's like you're treating it as 3 different systems. Like you have the kidney problem, and you get the liver problem, and you have the heart problem. Like different medication, different treatments, right? That'd be the logical thinking in the conventional medical sense. In psychiatry, psychiatrists have the benefit of having 20 diagnoses at once and don't have to prove anything. There's a feature of anxiety, feature of depression, feature of blah, blah, feature of stupid, I don't know, whatever the term is. Anyway, so we treat her with stellate. What happened? PTSD got significantly better. She went from 13 personalities to 3.
Wow.
The dominant personality now, instead of being monster, which is horrible personality apparently, became matriarchal, very pleasant, polite, warm. No more psychiatric admissions in a year.
Wow.
So you tell me, which diagnosis are we treating? We're not treating anything. We're just treating sympathetic nervous system overdrive. That's all we're doing. The whole diagnostic DSM, 5, TR, blah, 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 whatever, is just an imagination dream. We're dreaming. It's a dream. It doesn't mean anything clinically to me.
This is very hopeful. I mean, I find it very, very hopeful. And is the treatment available nationwide? I know that you do it at the clinic, but also can people find this at other doctors throughout the country, the U.S.? Or do you train other clinicians to administer this?
So yes, so I'm a CMO of Stella Mental Health. So we have 24 sites across the United States. So if you go to stellamentalhealth.com, you can find a site. And then also, there are other physicians who do it, no question. And some are superb, some are not. So at the very least, if you're going to see somebody outside Stella Mental Health, make sure they're board certified in pain medicine. Make sure they do ultrasound. If they're not, you may want to look somewhere else. There's a lot of people who make a lot of claims, but recently I had to report somebody to the state. He was a chiropractic physician who was doing it blind.
Oof.
I was like, what? And he put it up on YouTube. So I supplied that information to the state. But the point is, there is a variety of capabilities out there. Be careful. That's all I'm saying.
Well, you're going in blind with a needle to your neck. That's a little scary, I would think. You would want.
The first time I did a Stella ganglion was blind. So this
2006, you said. That was a long time ago.
No, 87.
87?
87. Then I did 30 years of fluoroscopy or X-ray guided. And now ultrasound is the latest fashion, I believe, or it's the right approach. My point is things have changed. You want to have maximal safety and maximal efficacy. If the physician knows where the needle is at all times and blood vessels at all times, that's a much easier way to go and it's much safer.
And what are the risks, if there are any?
There's always a risk. We're piercing the skin. So there was one study done in Germany in 1993. This is before X-ray, before ultrasound. So it was done blind. They did 45,000 stellates in country of Germany, right? A full country. So out of 43,000, they had, I think, 11 seizures, 9 pneumothorax, 2 allergic reactions. So if you hit a blood vessel in the neck, people have a seizure. Now, nobody died, thankfully, from any of those during that year when I studied it. Pneumothorax happens when you go really low. We don't go that low. So we go at C6, which is higher up. So it's much safer. But you can definitely hit a blood vessel. You can definitely have a seizure. And there's also very low chance of risk, like 1 out of probably 100,000 of infection or bleeding.
Which you would have from any needle.
Anytime you put a needle anywhere, that's well possible. But, it's like you asked me what are the risks. So
it's important for people to understand what the risks are and also understand that of all of the statistics that you have, the risk is pretty low.
Yes.
And the success rate very high.
Right. Our success rate is 80 to 85%. And then with ultrasound, hopefully the risk is non-existent. But again, here's why you want to deal with a competent physician. Like anybody who's Stella mental health related, we have a crash cart. We have intralipids. We have all the resuscitated equipment you need. And more importantly, the person who's doing the procedure is trained to deal with the complications.
Yeah.
Hopefully it never happens, but it's nice to know it's there.
This has been so informative and so helpful. And you and I are going to continue this conversation to talk about the epigenetic dimension of trauma and our DNA. We're going to do that in another episode. To learn more about the work of Dr. Eugene Lipov, please go to dreugenelipov.com. You can find him on social media, on Instagram and Facebook at Dr. Eugene Lipov. He's also on LinkedIn. The book that we're talking about and celebrating is The God Shot, Healing Trauma's Legacy, the Science, the Stories, the Solution. Dr. Lipov, one more time, please give the website for your nonprofit and for the 100,000 names that you are collecting.
Okay. The non-for-profit is called, I like subtle names, Erase PTSD Now.com. Very subtle. You can
very Erase PTSD.
No gift too small, no gift too large. We've had amazing donors and we've helped a lot of people. It also helps promote the research. So thank you so much for those people who have donated, and especially Linda and Glenn Greenberg. They were able to sponsor a study with NYU. So that's going to change the world.
Wow.
So thank you so much. And the name change website is It's PTSI. It's itsptsi.com. Very simple. The survey is 2-3 minutes. I just did a TEDx talk, and the title is One letter change can save a life.
Indeed, it can. PTSI, I love it. Dr. Eugene Lipov, thanks for sharing part of your day with me.
Thank you so much.
Thanks for joining us on Harvesting Happiness. This is Lisa Cypers Kamen on behalf of my guest, Dr. Eugene Lipov, wishing you kind thoughts, kinder words, and the kindest of actions. Until next time, remember, happiness is an inside job. Happiness is your inside job. Please go out and rock your day and remember to be kind to one another. Want to explore more sound ideas for better well-being? Check out our new bonus edition content at More Mental Fitness by Harvesting Happiness on Substack and Medium. Subscribe, listen, and share hundreds of downloadable episodes wherever you get your podcasts. Connect with and follow us on most social media channels. To learn more about lifestyle management and mental fitness consulting services, please visit harvestinghappiness.com. Harvesting Happiness and More Mental Fitness are produced by Lisa Cypers Kamen, Andrea Mengele, Robin Boyd, Andrea Daly, and the excellent team at Podfly Productions, including Eric Begay, Kimberly Beck, and Alec Guess, in collaboration with TogiNet Radio, KBUU, RadioMalibu.net, and is available on PRX, the Public Radio Exchange.